Good morning, everyone. Thank you all for being here. We've got a lot to discuss on our Huddle board today, so I want to get started because we have patient safety at 10. So our plan for the month is we go over our main opportunities. We've got a meeting this afternoon with Ed and Tim.
Yes.
Right? So I really want a strong agenda there.
Okay.
So everybody come with a couple of clear talking points that you want to speak to. I believe the meeting's at 2. Barbara, if you're available, you're welcome to come, okay? Emtala, Tammy's not in the room. We've got our CHS family here doing a mock survey, and from what I hear, it's going really well. We've made some adjustments to policies already. And I know Karen and Barbara, you're front and center with Christy on this, right?
Yes.
Anything to report for the group that's pertinent?
We have fine with our policies.
Yeah, we have a few
Good.
revisions from what you and I reviewed yesterday. So
okay.
we're meeting today at the BPOD meeting and we'll
Okay,
straighten out.
great, super. Greeley mock survey, we're still on task for that, for Joint Commission prep first week in May. Planning chest pain center move to TPSU. Gabby?
Janet and I are still working on that Tier 1 plan.
Okay.
We'll get back to you in probably 2 weeks.
Okay, super. Stethoscope pilot. So the individual stethoscope pilot is still moving forward for the 9th floor. So we'll get an update on that probably next week. 513, we've got DHSR coming in May to sign off the next project for the ED. So we're going to phase 3 on that. Mm-hmm. When we open phase 3, we used to call it the value office, but it's really going to be like the patient support office is going to be open. So we're really hoping that that's going to impact some readmissions. Taravath space, do we have an update on that? Carrie, I saw a note.
You see the email I sent you, 20,000 with construction and rewiring of the
Okay.
room. So I just need your A-OK to move forward on that.
Okay, the only question, excuse me, I have on that is when we move Nunley Clinic, will that space be available for potential use for sleep, or does it have to be up on the clinical floor? You don't have to answer that now, but I just was thinking about that yesterday before we commit to
We'll talk about
20
that.
grand.
Certainly outpatient space would be appropriate for sleep.
Okay.
We'd have to talk about what else would be in that location.
Okay.
Because sleep doesn't need
All that space. Okay.
But it certainly would be
Then we get those beds
EMU's
back,
gonna
so
have to stay there, so.
That's what I thought.
I don't think it would hold up moving forward with the construction, what we have. to
okay,
do
because we
right
still
now.
have to do for EMU. Okay. Did you guys get to the nurse manager meeting on Tuesday?
We did not. I
Okay.
sent an email to Brandy that day, but did not get.
All right,
through
then I'll
to
leave
her,
that
so-
here. I apologize for that. We'll get that on the May agenda. Pam, got your big Kaizen event, 425?
Yes.
Okay, you ready?
That's coming up, and I've been getting information. The piece that I will talk about this afternoon, if we still have that meeting with Dr. Brown and Dr. Seward, are the physician specialists. I want
Okay.
to just bring them in for a lunch meeting that's planned on
Okay,
Thursday.
I saw something there.
So I'm hoping that he can help identify
Okay.
who would be appropriate for that.
We'll talk about that time frame because Philip has to be in Cary this afternoon, so he
Oh,
won't be
okay.
here. So we might need to reschedule that.
Okay, all right.
Code Blue Kaizen event, excellent job, Gabby. That went really well. Some real strong takeaways from that, so I can take that off. That's completed.
We'll
Pain,
report out the next lane meeting.
Okay. Oh, great. And the PCA management, you're good there?
Yes, we need to rewrite the policy and work with Department of Education for re-education. Yeah.
Okay. All right. And we've got our new CONs on target. Suicide Kaizen, John Z, you're all signed off and ready to roll?
Yes, everything is in place. Our AMFs have been signed off, and we will be moving forward for May.
Okay, great. ECMO expansion.
I have
There's
the,
Janet. Hi, Janet.
I have the presentation ready to go with the exception of the financials that Grants is working on. and
Okay,
we're
super.
ready to present it with Dr. Dunn.
Great. Okay, so we'll get an update on that. And then Schwartz Center rounds was this morning.
there was
I
one,
heard.
yeah.
Good turnout?
Yeah, very good. About 85 people came.
Awesome.
Yeah,
Very
very
Great.
good.
I got to for the first time.
And I heard it was right on point with where we're heading with our pain management.
Yeah, it was really good.
Excellent.
Great.
Good. Okay. Any other things going on this month that we need to add to the board? All right, let's jump over to our problem list. See if we have any updates. Gabby, you updated us on our patients on isolation work, and Sue, I've seen the data coming from the rounding, and we're like 98 to 100% compliant. So
We'll continue our every 2-week auditing. If we want to go ahead and close that, we've been compliant with the 98%.
I'd be happy to.
I'm great with that.
We're good with that? We've got enough confidence? All right. Let's close that one. Good job. All right, so jump into our A3s, our Master A3 on quality. There's a couple of new things that I want to hand out to you guys if you could entertain me on this. Thank you to Sue, Gabby, Johnsy for helping me put this together. What I'm trying to do is take all of our quality goals, put them in one place, so we kind of know where they all are. So what this includes is the goal itself, what I believe the focus area is around that particular goal, who our dyad leaders are, whether an A3 has been completed or not. And while this column says leading indicators, it's a little bit of leading indicators and results.
Okay.
I'm going to add a little more to this and do like a red, yellow, green, kind of stoplight. If any of this is yours, if you could just help me fill in the blanks. From this document, we'll be able to have a nice, like I said, red, yellow, green dashboard. And then thank Johnsy for being my guinea pig here on the driver diagram. But if you would take one of those and pass them out. What we'd like to do with the Quality and Safety Steering Committee is really push it towards a G4G model, where it's not just a couple of people speaking, but everybody gets to report on everything that's going on so that we can keep it moving. So what we were playing with was a driver diagram. So what you have going around for you, for example, is the quality goal on the patient safety composite. 2 focus areas within that composite we're working on are falls and hospital-acquired pressure ulcers. There's top 2 countermeasures, not all 15, but what's your top 2 countermeasures, and what are your leading indicators? So we're thinking about a format such as this for every one of our quality goals and sub-goals to be the agenda for Quality and Safety Committee. So we're going to test it this month. So if you own any of these goals, if you could play with this, and then I'll send this out electronically so you can kind of delete Johnsy's words and put in your own tactics. So Barbara, for you, with the PCO2, that would be your focus area. So kind of driving Jeff, the unintended lacerations and punctures. So we'll kind of drive that down this way, and hopefully we're doing okay. We are going to get a length of stay reduction, right, Pam? 24-hour rule's been pulled back, so we should get a little help with our math there. But we'll work on these and push these things more forward towards the blue. Right now we're a little red in some of our goals, so we'll keep pushing that forward. The second A3 we have up here is on our patient experience around leader rounding. And I just want to commend all of the inpatient managers. They're doing a fabulous job with this. It's making a difference because look at our data. Communications with physicians and nurses is up, and also likelihood to recommend. So Helen and I are working on making this a bigger visual. I think it's a good visual. It's our biggest areas of opportunity are when the patient has a cognitive, is cognitively impaired. It's hard for the manager to have a dialogue with the family, and also patient sleeping, and you're just constantly kind of looping back. So we'll work on those areas, but awesome results, I think, as far as that goes.
Just to add to that the focused education for the leaders and the support that they've had on techniques in rounding has been terrific for them too.
So, okay, great. Well, I'm gonna
They're getting to it, they're getting better at it too, I think.
I'm gonna use that opportunity to manage up Amy and Jean Martin, because how many classes did you do in 2 days,
We
Amy?
did 7 or 8 classes. We actually had 40 people come
Wow,
through.
that's great. Anything else on leader rounding or quality that you guys need to share? How about some spotlights? I want to spotlight Christy Pascal. She has done an awesome job recognizing the nurses with ladder and certification and stuff. And also, as of yesterday, Jessie Nowak has been voted in as Vice Chair for Nursing Congress. Yeah, so I'm excited about that. Just some monitoring things, guys. It's real serious on lab specimen. Okay, let's make sure we're 0 defects on this. And I followed up with Holly because I've been hearing a couple of issues with some of the new graduate nurses not labeling correctly. So make sure their preceptors are double checking them, and I'll follow up with Holly on that.
And there's another tip sheet that's gonna go out
Okay,
related to specimen
Specimens?
labeling.
okay.
Um,
All right,
It's
good.
been put together as of yesterday.
Okay.
So we should see that probably today.
Great. What do you guys need from me this week? Anything outstanding that anybody needs from me? EMTALA policies. You've got the Nunley Clinic. Nope. All right. All right, we're good then. Let's go and get ready for patient safety call. Thanks, everybody. Thank you.